Hello, this is Kim Jong-il. Today's topic is part 2 of decrowding for non-extraction treatment. In case of crowding, many orthodontists first create space and then align the teeth. The teeth are aligned while space is maintained as much as possible. Elastic thread, ligature wire, NITE overlay, L-loop, and etc. are well used for alignment. As in Photo A, space is created for align the crowded lateral incisor, and elastic thread is tied to the main arch wire to move the lateral incisor labially. The problem with the elastic thread is that it tends to loosen during tying. So I recommend tying with ligature wire as shown in Photo B. When ligature wire is tied to the main arch wire, it is slightly deformed like this, and the restoring fore of the main arch wire moves the ligated teeth. As in Photo C, NITE overlays can be used as well. When elastic thread, ligature wire, and NITE overlay are used, open coil spring should be used on the main arch wire. Sometimes, L-loops can be used to level crowded teeth. The amount of crowding is more than 4 millimeters. Low-profile brackets or lingual buttons are temporarily attached for orthodontic traction. In orthodontic treatment, the teeth typically move 1 millimeter per month. So a lingually displaced tooth like this does not move into the proper position in just a month. Because the teeth slowly moves 1 millimeter per month, the brackets are attached after space is created to some extent. Orthodontic traction should first be performed when the amount of crowding is more than 4 millimeters, and NITE overlay is better for 4 millimeters of crowding. For less than 2 millimeters of crowding, NITE arch wire can be directly ligated. For a palatally displaced lateral incisor, space first created by using open coil spring on 016 SS main arch wire, before it is bonded with a bracket or a lingual button. Then, elastic thread or ligature wire is used to pull the tooth. If a bracket is bonded, use an SWA bracket upside down. Details about this is discussed in the lecture on treatment of palatal displacement of maxillary incisors. After the upper lateral incisor moves labially to some extent, leave the main arch wire and use NITE overlay. Then change the main arch wire to ZO4-tier NITE arch wire. If torque control is required, 016 022 SS arch wire with torque can be used to obtain desirable root movement. Crowding is categorized into vertical displacement and horizontal displacement, which is the palatal displacement of the upper lateral incisors or rotation of the incisors and molars. In today's part, treatment of vertical displacement will be discussed. When there is a crowding on the upper canine, how will the adjacent teeth move when they are aligned? The premolars will be mesially rotated, and the lateral incisors will be distally rotated. From the side, the premolars will be mesially angulated, and the lateral incisors will be distally angulated. However, if the brackets are strategically bonded to the central incisors, lateral incisors, first premolars, and first molars, and open coil springs are used, the mesially angulated and rotated first premolars and distally rotated and angulated lateral incisors can be uprighted. Figure A shows full bonding, and Figure B shows strategic bonding. In full bonding, many orthodontists mainly use copper NITE arch wire. The buccally displaced upper canines move palatally into the arch, while the adjacent lateral incisors and first premolars move buccally. From the side, the gingivally located upper canine moves occlusally, while the adjacent lateral incisors and first premolars move gingivally, increasing the possibility of lateral open bite. On the other hand, compared to full bonding and use of copper Nitti arch wire, strategic bonding and use of open coil spring and Nitti arch wire can maintain the lateral incisors and first premolars in the arch while moving the canines into the arch. Therefore, in case of crowding, I use strategic bonding and open coil spring rather than full bonding and superelastic arch wire. Crowding can be classified into bilateral and unilateral. In case of unilateral crowding with acceptable profile, non-extraction treatment is possible by strategic bonding, which minimizes labioversion of the incisors. On the other hand, bilateral crowding is difficult to treat with non-extraction approach, and there is a high chance of premolar extraction. During diagnosis, it should first be classified into class 1, 2, or 3 crowding case. In case of class 2 crowding, there is a high possibility of only upper premolar extraction treatment. However, as the skeletal pattern turns into a class 3, there is a greater possibility of non-extraction treatment. In case of class 1 and 2, it can be effective to use mini-screw. On the other hand, in class 3, mini-screw is not that effective. This patient has an acceptable profile. There is a unilateral crowding, and the first thing to consider is which brackets to use on the upper incisors. For non-extraction treatment, 0-degree brackets are strategically bonded to the upper central incisors, lateral incisors, second premolars, and second molars. Maybe it is better to attach brackets on the upper central incisors, first premolars, and first molars, because the upper midline, which is deviated to the right, should first be treated. Anyway, either option is adequate for creating space. It is easy to create space by using open coil spring with tight cinch back. After gaining space, keep open coil spring in place and move labially displaced upper canine into the arch. At this time, attach lingual button on the palatal cusp of the upper first premolar to adjust it. This will be discussed in detail in retrusive control part. This patient has a good occlusion on the left but severe crowding on the right. Use open coil spring to create space. And if it comes in contact with the upper canine, make a step on the arch wire so that open coil spring does not interfere with the upper canine. After leveling the upper canine, the treatment can be easily finished by using Mio in the upper and lower arches. These are the pre- and post-treatment panoramic X-rays. The profile did not change much from pre-treatment to post-treatment. In addition, even though space was created in the upper anterior teeth, there is no sign of root resorption. These are the schematic diagrams of methods for resolving crowding. In the first picture, crowding on the upper canine is observed. Use open coil spring on 0.16 SS arch wire with step and pull the upper canine into the arch. Then the upper canine slowly moves into the arch. After the upper canine has moved to some extent, maintain 0.16 SS arch wire with open coil spring and use 0.14 Nitti overlay arch wire to keep pulling the upper canine. This will move the upper canine into the arch while the arch is maintained. As the upper canine moves close to the arch, Change the main arch wire to 014 NTI and directly ligate on the upper canine. As in D1, rotation wedge can be used if the canine is rotated. Or as in D2, 014 SS arch wire with L loop or 016's X022 SS arch wire with L loop can be used to directly control torque if needed. There are cases of crowding with impacted upper canine. Especially if the upper canine is palatally impacted, it is important to match the gingival margin after the upper canine is aligned. Keep in mind that it is better to surgically expose impacted teeth so that they can erupt spontaneously. This is a Class 3 malocclusion patient with severe crowding on tooth 13. Tooth 13 should not be extracted if possible, because its extraction can lead to arch distortion. In non-extraction cases, use 0-degree brackets on the upper incisors. As already mentioned, surgically expose the palatally impacted teeth and wait about 6 months for eruption. In the meantime, create space in the upper anterior teeth. Early in the treatment, it is better not to attach the bracket on tooth 12, because if it is bonded and open coil spring is used to create space, its root can overlap the root of impacted canine and be resorbed. Therefore, even if it takes a long time to create space for tooth 13, tooth 12 should not be bonded. When space is created and tooth 13 is moved, it is necessary to use torque control arch wire because only the crown is moved. Then the upper and lower arches are aligned, and meow is used for finishing. What is the torque control arch wire? When a crowded tooth in the upper arch is aligned, torque control arch wire may be needed if torque has to be adjusted to match gingival margin with adjacent teeth, and etc. Torque control arch wire will be discussed in detail in torque control arch wire part of the lecture. In this patient's panoramic X-ray, although severe crowding and an impacted tooth are observed in the upper right quadrant, favorable treatment results can be obtained by creating space and leveling. This is a case of Class 3 malocclusion with impacted tooth 13. Tooth 13 has to be pulled while space is created. When creating space in the upper anterior teeth in non-extraction treatment, 0-degree bracket must be used on the upper incisors. Taking the direction of impacted canine into consideration, TPA with auxiliary hook is used in order to efficiently pull the impacted canine. This patient has a palatally impacted tooth 13. Space is created in the upper arch by using open coil spring on 016 X022 SS wire with anterior crown lingual torque. On the next visit, open coil spring is activated by inserting a spacer or sliding hook. Repeat this process until sufficient space is created to resolve crowding in the upper arch. Labioversion of the upper incisors is minimized, and the roots can be moved labially as well. The lower arch is leveled and meo is used for finishing. Even though there is a severe crowding or impaction of the upper canine, the treatment can be easily finished if space can be efficiently created. These are pre- and post-treatment panoramic X-rays. Despite orthodontic traction of the upper canine, the roots of adjacent teeth are in good conditions after the treatment. In the third case as well, there is a severe crowding in the upper arch and no crowding in the lower arch. This is a Class 3 deep bite case. In case of Class 3 deep bite, it is hard to attach upper incisor brackets in the correct positions. Therefore, I recommend the use of posterior bite block with anterior covering PBBA in case of Class 3 deep bite. PBB posterior bite block covers only the premolars and molars, but PBBA covers the incisors as well. I usually use PBBA that covers the incisors as well. Brackets are strategically attached in the maxilla. Space is created for crowded upper lateral incisor, and torque control arch wire is used to control the lateral incisor. Mio is inserted in the mandible, and Class 3 elastics are used to improve the incisor relationship. Typically, the first loop of Mio is located between the lateral incisor and canine. However, the first loop of Mio with torque control is located between the central and lateral incisors. Mio with torque control is inserted in the maxilla in order to control the torque of upper lateral incisors. That is, root labial torque is applied. The treatment becomes easier by first aligning the maxilla and then mandible, and finishing with Mio with elastics in the upper and lower arches. In panoramic X-ray, upper anterior crowding and unfavorable angulation of tooth 34 are observed. Brackets were attached in correct positions, and the teeth were uprighted by using Mio. At this time, the third molar must be extracted. This is the superimposition of the pre- and post-treatment cephalograms. The entire lower teeth moved posteriorly, and the entire upper teeth moved anteriorly. Slight labioversion of the upper incisors is inevitable, and it would have been more if SWA brackets were used. Therefore, caution should be exercised in non-extraction treatment of Class 3 malocclusion. Sometimes the upper and lower canines are distally angulated as in the photo. Since it is normal for the gingiva to be positioned distally, a slight mesial angulation is good for the teeth. Since it is normal for the gingiva to be positioned distally, a slight mesial angulation is good for the teeth. If the lower canine is distally angulated, it is difficult to carry out non-extraction treatment. For premolar extraction treatment, it is better to extract the lower second premolars than the first premolars. This is because when the lower first premolars are extracted, the crown rather than the root is likely to move posteriorly when the extraction space is closed. Of course, it is possible to move the root as shown in the picture. However, root movement is difficult and takes a long time. Therefore, if the lower canine is distally angulated, I believe that it is advisable to extract the lower second premolar, move the first premolar posteriorly, and move the root of the canine. In panoramic X-ray, it can be observed that the lower second premolar was extracted to move the first premolar posteriorly and move the root of the canine to correct position. Let me emphasize again, if the lower canine has to be moved distally, the second premolar should be extracted in the mandible. In the maxilla, either the first and second premolar can be extracted. Tooth movement is not easy in the mandible because it is composed of compact cortical bone. On the other hand, even the root movement is easier in the maxilla, as it is composed of spongy cancellous bone. Therefore, in the maxilla, it is advisable to consider crowding and canine relationship when deciding which teeth to extract. In other words, the lower second premolar should be extracted if the lower canine is distally angulated, but either the upper first or second premolar can be extracted when the upper canine is distally angulated. In this patient, the upper first premolars were extracted and proper upper canine angulation was achieved. The treatment procedure of non-extraction treatment of crowding case is largely divided into strategic leveling, tooth alignment, and finishing. What does strategic leveling mean? Space is created for crowded teeth, and the teeth are aligned. Then, open coil spring is used in the first molar area to upright and derotate the second molar, which is the terminal molar. Lastly, Mio wire is used for finishing. Derotation and uprighting of the second molar is important. Before treatment, the molars were meshily angulated, but they are slightly uprighted after strategic leveling. When open coil spring is used in the first molar area with loose cinch back, a little space is created or the contact becomes loose between the first and second molars, making it much easier to upright the first molar. This effect is further maximized by using Mio wire with tip-back activation during finishing. What retention should be used? It is good to use bonded retainer between the canines and a wraparound removable retainer in the maxilla. In this part, vertical displacement of crowding, especially that of the upper and lower canines, was discussed. In the next part, palatally displaced upper lateral incisor and rotation of the incisors and posterior teeth will be discussed in detail. Thank you for watching.